bit by bit, I'm going to show images of epidermoid cysts. Epidermoid cysts are ectodermal inclusion cysts, like dermoid. But as the name says, epidermoid cysts contain only a layer of squamous epithelium and no skin appendages that are located in the dermis. Epidermoid cysts are much more common than dermoid cysts, about 4 to 9 times more common, and about half of the epidermoid cysts occur in the cerebellopontine angle. On MRI images, and these are very old images from 2001, an epidermoid cyst resembles CSF on all sequences except FLAIR, and epidermoid cysts have restricted diffusion, and we'll come back to that a little bit later in this video. So in the previous video we talked about dermoid cysts, which were inclusion cysts occurring anywhere along the lines of embryonic fusion by sequestrated dermal cells. And I have some electron microscopic images from the fourth embryonic week. You can see the closing of the neural tube, and the edges of the neural tube are the neural crest cells. And it is important to realize that the facial dermis is derived only from neural crest cells, whereas in the rest of the body the dermis is derived from lateral plate mesoderm. So that's the reason why dermoid cysts occur much more in the head and neck region. I also mentioned that epidermoid cysts occur a little bit later in embryology. So early you have all the skin layers and an inclusion cyst in the midline. And if it happens later, you only have the skin cells itself without the appendages, and it occurs a little bit off midline. And the epidermoid cysts occur when there's inclusion of ectoderm, when the secondary cerebral vesicles are formed. So, for example, the otocyst and the optic disc in the diencephalon. This is an electron microscopic image in the 4th-5th gestational week. You can see the closed neural tube here. This is the surface ectoderm. You can see the folds, and there are going to be these outpouchings for the ear and for the eye. And you can imagine that if there's some misfolding in these outpouchings for the ear and for the eye, that there's some inclusion of skin cells, and this gives rise to an epidermoid cyst. Epidermoid cysts also occur in the posterior fossa in the 4th ventricle. And if you remember a very old video on the embryology of the posterior fossa, you might remember that in the 5th and 6th embryonic week there's the pontine flexure and folding in the posterior fossa. So that's how you can get inclusion of ectodermal cells in the 4th ventricle. So an epidermoid cyst only contains the upper layers of the skin, and they desquamate their keratin. And keratin is a very strong horn-like substance. And this is an epidermoid cyst in the posterior fossa with high T2 signal and restricted diffusion. And you see on microscopy, this is the wall, so it's one layer of squamous epithelium. And there are these layers of keratin that form these concentric lamella. And these concentric lamella explain why there is restricted diffusion in an epidermoid cyst. And in the cerebellopontine angle, if you want to look for restricted diffusion, I prefer to do a non-EPI diffusion sequence, for example, from a cholesteatoma protocol, and not the DWI you typically have in a protocol for brain ischemia, because in the posterior fossa you have soft tissue, bone, air, so there's a lot of inhomogeneity of the magnetic field. So non-EPI diffusion is better than just a DWI from your ischemia protocol. In the differential diagnosis of an epidermoid cyst or dermoid cyst, inflammatory cysts like neurocysticercosis that also have a content that differs from normal CSF, and if the content is the same as CSF on all sequences, you can think of an arachnoid cyst, and we talked about that very briefly in the differential diagnosis of Blake's pouch cyst, and we talked about the primitive Mannings, and we're going to repeat and look a little bit more into detail on the origin of the leptomeninges and arachnoid cysts in the next video. So I do hope you will stay tuned.